Hey guys, this is Jasha Connor with Practical Wellness Podcast. I'm going to be joined by Courtney Davis. We are both nurse practitioners. We have significant history in the medical field, and we are here to teach you about health. If you are ready to learn how to get healthy, we are here to teach you. We are so excited to bring this to our communities and to teach you health and wellness. Hey Courtney.
Hey, how are you?
I'm good. You ready to do this?
I'm ready. We're all set up. The most
awesome.
Official I've ever been.
Good. So this is going to be our first ever episode of Practical Wellness. We have Courtney here. My name is Jasha. We're going to talk a little bit about what we want to do, what we want to bring to our communities. We're so excited about this. Courtney, I was just down visiting you not too long ago. That was such a great visit.
Yeah, I'm so glad you came down. It's been so long since I've seen you. 1 year is too long.
I know. We started working together in Lebanon ER. How long ago was that, Courtney?
2013, question mark?
Yeah, it's
somewhere
been
around
a long time. Been a long time.
Yeah.
That was a fun time for sure. You know, working with Courtney, it was always an experience. That was pretty amazing. And now, she's went on to Florida. So I love that I get to take business trips to Florida and visit you, Courtney. It's pretty awesome.
Yeah, you should move to Florida.
Yeah, I want to. I sure want to.
One day.
But,
Your retirement plan.
That's my retirement plan. Absolutely. So tell us what you've been doing.
Well, I've recently started a practice similar to Ginger Wellness. It's called Forward Wellness here in Crawfordville, Florida. And we focus on direct primary care, and we also do IV vitamin infusions and hydration, weight management programs, health coaching, and then we also offer a lab service to Wakulla County, which is a really great thing because people don't have to drive 25 miles to Tallahassee anymore to get their blood work done.
Right. You're basically bringing better access to healthcare, in your rural area.
That. Exactly
it's so
that.
important.
And it is really important. And I think we all knew that. And then when you're on the other side of it, you just realize it's really, really bad and nobody is helping. And the only people that are benefiting at all are healthcare corporations and insurance companies. No providers benefit and no patients benefit from that at all.
Absolutely. So a lot of my experience has been, we did a lot of ER. I did a lot of critical care.
Yeah.
You've done a lot of ER as a nurse practitioner, Court. So,
right.
We've both been in the system. We've both, taken care of patients within the system. We absolutely love it.
Right. And when you switched over to your renal care, you saw it from a different side too, from outside of inpatient and, the emergency setting. So you can kind of see it full circle that way.
Absolutely. And for those of you that don't know what renal is, that means kidneys. So I did do some specialties in kidneys and lungs for a while and loved it.
I forgot about that.
I love my patients. I did critical care. I trained a lot in critical care as a nurse practitioner, and I enjoyed that as well. And then I started Ginger Wellness, and my biggest thing about starting Ginger Wellness was that I wanted to bring something different to our area. I feel like there is such a huge gap in education to the people, and we don't have time. Healthcare is so bogged down. There's so many reasons for it.
Mm-hmm.
We're going to be bringing so many things to this podcast, and one of the things that we definitely want to talk about is healthcare disparities, because it's huge, and that's going to be a whole podcast in itself, Court.
Yeah, a whole probably 2 or 3 episodes just on all the problems in healthcare. And I think that everybody listening and then everybody who knows us knows that there's so much to say about it. And if you haven't been in the healthcare system and you've been fortunate enough not to have to encounter with your providers, on a regular basis, or too often, or haven't had a severe illness, then you really are so much more fortunate than you even thought before, because it's not great. And people spend thousands of dollars a month and a year on healthcare insurance, and they walk through the door and they're treated just like another number. And
we want to change that. We do want to change that, but all healthcare people, we have worked with some amazing people, because there is true people in healthcare that truly want to help people. Never is their intention to not give good care, but there's so many factors that come into it, that play into it, that cause those disparities and puts up barriers for these providers to be able to provide good care.
The incentives from either insurance companies or corporations, the reasoning behind your 45-minute wait in the lobby, the reason why you have to see 30 patients a day to get a paycheck and make sure everybody's going to eat. It's really bad. And providers and patients are ground into the ground on a daily basis, and you wonder why they're miserable. Patients aren't happy with the service they provide. Providers are looking to get in and out of healthcare. They want to change. And I'm the happiest I've ever been in healthcare, knowing that I'm doing something better and what I got into healthcare for. People and healthcare providers inherently get into healthcare to help people, not to, push them through a system, make them another cog in the machine and collect a paycheck. Like, yeah, we're all here to get paid, but we also really love to see improvements in helping people.
Absolutely. And it's such a difficult system to navigate, and we have said this on numerous times, like when we've had families in the hospitals, and we don't know how people do it when they don't have family in healthcare.
Absolutely. I just wish everybody... I wish everybody had their own nurse or their own nurse practitioner, or their own physician assistant, their own MD, their own DO, somebody in their life that could help them understand it, because patients they get talked at, not to, and they leave with less questions. I can't tell you how many times I've got a patient in primary care that came, for an ER follow-up, and they say, I don't know what happened. I don't even know what I had. I don't know what I'm supposed to do. And that's the important reason that you go to your follow-up. But you should have some answers when you come to your primary care provider. You shouldn't have no clue what happened to you in the emergency department. And I still work in the emergency department. And I try so hard to advocate not only for, the patients that are there, but also speak with my colleagues and say it's really important that we make sure they know what's going on, because when they leave here and they follow up with their primary care doctor, they are coming back to us and they're saying, we don't know what happened. So take the time to go and educate. It takes not that long. Hey, this is what we did today. This is what we ruled out. This is what we did find. These are the medications you're going to take. This is what you need to do to follow up. And then if this happens, you need to come back and see us. Those conversations aren't happening anymore. Physical exam isn't happening anymore.
That is one of my biggest pet peeves, Courtney. Thank you for bringing that up.
That just hit me. I'm like, that's crazy. So I can't wait to hear what you have to say about that. It happens all the time.
Oh, man. And this is going to be one of those things to where we're going to be talking about this in a podcast.
Yeah, we got to reel it in. We got to reel it in.
When you go to a provider and, like, for instance, you're going to them to get specific care. I have literally diagnosed or built my treatment plan based on my physical assessment.
Right.
But it's like they don't have time anymore, so it's easily forgotten.
The time constraints.
Sometimes it's not even intentional, but it's easily forgotten, and it's the most important step when you're taking care of somebody. It's doing that physical exam and listening.
Go. I'm sorry, I cut you off. Go ahead.
No, I'm listening to their complaints. How are we treating people when we don't have time to sit there and understand what is going on with them?
I know. You can't just take the one complaint they have and say, okay, let me fix that. You need to dig deeper. When? How long? When? What makes it better? And I know that all healthcare providers know that. And I know if I was talking to anybody other than you, they'd be like, oh my God, you're right. We do sometimes drop the ball on that, and it's because of X, Y, and Z. And nobody would be proud to say that. And some people may or may not admit that, but it happens, and I've done it myself. You're in a rush, and you've got 17 people outside waiting for you, or this, that, and the other, and there's so many other intrinsic factors that can change your day or your flow or what's going on. And I can't sit here and not be honest and say that I skipped a piece of my physical exam that probably could have been a better example for others.
Right.
And
well, it's rushed. But
it's rushed.
But we've bogged the healthcare system down, and there's so many factors that go into it. That's why that's going to be its own podcast, because there's so many different factors that go into it. Society and culture plays a huge role in how healthy we are. I got a story to tell you, Courtney. I'm going to need you to hear this story.
Okay.
So I was at dinner last night. My nurse Carrie was telling me about her trip, to Vegas. Her and her husband went to Vegas. So there is this restaurant.
How long ago was this?
I really don't know.
Okay. Yeah. All right. Restaurant.
Yeah, don't know. Yeah. Don't ask me specific questions, Courtney.
I'm interested. Hey, that's important. You have to ask the specifics.
But it's still there. I do know that because I had to Google it to make sure that this restaurant exists. It does exist.
Okay.
I've looked at the menu. Okay. And so it's literally called the Heart Attack Grill.
Oh, I have heard of that place, and I also did not visit it while there, but I've seen some Instagram, but I'm excited for your story.
Oh my gosh, Courtney, how did you not tell me about this? Because it just blew my mind last night. So
really?
Literally, yes, it did. The Heart Attack Grill. They make their menu, their hamburgers alone are based on heart bypass surgery. So like it's called quintuple bypass, quadruple bypass. Like you can get whatever burger you want as a bypass, and you can add 40 pieces of bacon for $6.
Yeah,
They literally
God.
have a scale in the front of the restaurant,
Oh
and if you
my
weigh
God.
over 350 pounds, your meal is free.
No.
Yeah. And if you
You're
don't
joking.
eat your meal, I'm not joking. I'm serious.
So it's
And if you-
promoting obesity and
it
heart
absolutely
disease
is.
and
It absolutely is. But
oh my gosh.
if you do
And
not eat your full meal, Courtney, they have servers dressed up as nurses that will spank you.
Okay. That's dirty.
It's
That's a
just
fetish,
wrong.
I'm assuming.
But,
I mean, it's Vegas, so I guess what happens in Vegas is different than what we should allow everywhere.
Vegas,
But
it
the
speaks so
300-pound
loudly,
thing gets
though,
me
Courtney,
about our
country,
about what we're talking about. Absolutely, you're so right. And I did see that when I was researching my trip to Vegas, and I did not venture through there. We went to like the Blue Man Group and some Zoomanity shows or something like that. But I did see that on like the things to do while in Vegas, and the heart attack grill is not something I was interested in. First off, I was overweight at that time, and I didn't want to highlight that. That wasn't something I wanted to promote and keep going. I was trying to get healthy, and that is not something that we should be proud of in America.
So why does that exist, though? That exists because we buy it.
Because we buy it and people like it,
Americans
and then it makes them
buy
feel
it.
comfortable. Yeah,
but-
I imagine there's some sense of belonging there to others, maybe, or like I'm going to a restaurant and it's okay, or I would be
just
interested to see
wonder-
the demographics that visit.
Oh, true. And I'm sure it's several different types of demographics. But my biggest thing is, do they truly understand that when they go buy that quadruple bypass, they are literally buying them a quadruple bypass in likely like 10, 15
Maybe
years?
there's a consent form involved.
Maybe.
There should be.
Because,
Maybe we should
that's-
speak to their legal team.
That's literally what it leads to, And there was another
Right,
one. It was
yeah.
called a coronary dog. And I'm just like,
What?
why would you want that?
That is.
But it's
the
where
scale.
America is.
I can't get over the scale thing. I'm over people dressing up like nurses to do things that are a disgrace to
man.
our profession.
I mean, you and me both.
We have to fight already so much for people to understand what we do. Not only as
Absolutely.
nurses or, nurse practitioners. I actually had a patient today who came in for the lab service this morning, and he was like, "So you're a doctor's office?" And I said, "Well, I'm a nurse practitioner, but yes, I run a primary care clinic here as well." And he goes, "Oh, well, you're almost there. You'll be a doctor in no time." I'm like, "Well, actually," and and he's like, "I gotta go," and I'm like, "Oh, the world may never know," So
Yep.
it sucks. And even I've seen in our colleagues some even nurses, like registered nurses or licensed practitioner nurses, they don't understand the role a nurse practitioner plays either. So I think that there's so much more we can talk about. There's so many things that we can go into detail on our
Absolutely.
episodes here together with Practical Wellness, because there's so much to talk about. And you and I together, it's been so long. We talk too much already, so we're gonna have to definitely keep this going. But there is
Reel
a
it in. We'll have to reel it
ton of
in.
things. Yeah,
There is, but
we
it's
will.
going to be exciting, because I think a lot of the times, when we talk about big pharma and big food, like you mentioned that, you're like, are we going to
Yeah.
talk about that? Absolutely,
Are we gonna
Courtney,
talk
we're going
about
to talk
it?
about
Yeah.
that. Yes, we are. Because
Because
the
and the
people need to
reason,
know.
yes, and the reason we're going to talk about it is because we talk about it with our patients. So why aren't we trying to spread it everywhere?
Yes.
And this is a really good opportunity for not just us, but for also the communities that are involved with us. Because if you're not a patient of mine or a patient of Jasha's, you're not getting the care that you deserve. I'll tell you that right now. You're not
No.
getting, you're on average, if you have one chronic disease, you may see your doctor twice a year. If you have none, maybe
Right.
once a year. If you have 2 or 3, maybe 4 times a year. And
Right.
your average visits are going to range between 15 to 30 minutes for your wellness. That includes your entire experience with the clinic that you're a part of. So
Yeah.
that includes your check-in process, your vital signs, all your medical reconciliation, all the questions that everybody asks you, the 100 million surveys that insurance companies make you check and fill out no matter how many times you've done them, ask you if you want your pneumonia vaccine a million times even though you've already declined or you've already received it even. And then by the time you get to see your healthcare provider, there's seven minutes left of that. And 7 times 4 is 28, you guys. That's 28 minutes to discuss your healthcare in a year. And we wonder why healthcare
We have
or
problems.
people can't manage their disease. And Jasha, you sent me an article this week or last week about doctors and nurse practitioners and healthcare providers and how long a study had shown. And forgive me because I don't have the statistics, and maybe we'll link it below or something. Okay, so you tell it, because there's a 24-hour. A study showed that 24 doctors and nurse practitioners.
So
27 hours is what they would need per day to do what they really need to do.
But that doesn't even count sleeping, Court. Like that doesn't calculate their sleep time. That's what we have to understand.
And that's based on the volume of patients that they're seeing.
Yes, but that's literally they need 27 hours to give what guidelines recommend for us to do to take care of people effectively. They would need 27 hours in a day to complete that. But
God, can you imagine?
Healthcare's overrun. They don't have the time. Anytime something grows big, problems incur,
There's a fine line, right?
It's any system that grows big, problems incur, but the people suffer. But a big part of something else that I want to definitely hone in on this podcast is, what can the society do? How does society contribute? I can tell you one way they contribute. You go eat at the heart attack grill, you go see your primary care provider, and you need to be put on 20 different medications to prevent a heart attack or stroke. Like, what are we doing?
I know.
What are we doing? Where's the education?
With preventative. Yeah, and everybody knows that. Like the first step in disease prevention is going to be to prevent it, right? Like, you want to avoid it at all costs. You don't want to treat a problem when you get it. It's not. Think, for instance, when you're driving. You're paying attention, you're being aware. You don't get in the car accident, you pay attention to avoid the car accident. And that's how we should be treating our health, watch out for these signs. And we know that, that stop sign's coming. We know we need to slow down. We know that cardiac disease is linked to a lot of different dietary measures and obesity, and we need to slow down. And
we need to slow down. Absolutely.
Yeah. And so I'm excited because and you can experience this with, Jasha at Ginger Wellness or me at Forward Wellness. We have longer appointment times, and we will talk to you about all of your medical problems, and we will formulate a plan, and you will not leave here with more questions than answers unless we've talked about another question we need to work on together. So,
and part of the
that
reason
is
the
best part.
The reason that I wanted to do this in the first place was because, I was working critical care medicine. I was working in kidneys. I was literally helping people die better, because,
oh my God.
In critical care.
I hate even hearing that.
But it's true if you think about it, because I got them too late when I was dealing in critical care. And so, and in the kidneys, I would have so many 55, 60 years old, they'd come in and they'd say, this is falling apart, this is falling apart, this is falling, what happened? And it's like, it doesn't just happen overnight.
It's not a flip
switch. It's
switch.
happening over 30 years. And a big part of what I want to do is I want to get to these people when they are 20 and 30 years old.
Yes, and I want to so much
educate
fun.
them so that they know how to prevent this in the future, because it's catastrophic, right?
It
is. You don't want to
so
spend
bad.
your retirement
It's
in
so
a doctor's office.
I have yet to meet one patient that's like, I would really like to be, maybe 5 or 6 visits a year, a few hospital admissions. I'd love that. Nobody wants that. And so if we can get to you early. Yeah. And it's not fun. Nobody likes it. You want to, when you're in your years, when you're not graduated, Jesus, when you're retired, you want to go and do the things that you couldn't when you were strapped down with your job and your kids and things like that. And we shouldn't wait for that either. We should be traveling and doing what we can to spend time and enjoy our lives now. But if we can get to people early, that can last longer, and you can have a better quality of life. I always feel so terrible for patients that have, they went to the doctor, and then they went to the ER, and then they went to the doctor, and they went to the ER, and then they were admitted for 10 days.
And then they have 10 specialties to go see.
Yeah, and I can't. I've had a couple of patients in primary care. They're like, Courtney, can you handle this now? And that's something else we need to talk about, is how many primary care providers will punt everything to a specialty. Like, let's work some stuff up, guys. Let's see if we can fix it. That's the goal.
Yeah, but they don't have
care.
time, Courtney.
I know,
literally do not have time.
No, I know that. And I know that firsthand because, like you said, we saw it full circle. And this is how, I wanted to do this, is because I left the ER in the beginning of COVID because, just a little lifestyle, not a lifestyle change, but, COVID scared everybody. We didn't know what was going to happen. It was all brand new. We know a lot more now than we did 3 years ago. But, I started thinking nobody's going to care and put on my tombstone, Courtney put in 4 central lines and, did this and did that in the ER. And I was worried about my kids and the quality of time that I could spend with them. And so I got the opportunity to move into primary care, which I was like, to be honest, I was like, gross, I don't want to do that. I hear it's a nightmare, and you take everything home and you have a million patients, and I love clocking out in the ER. Once you're done, you're done. You pick it up. Every day's a new episode, you know? And so, but I wanted to see the other side of things. I wanted to say, maybe I can keep people from going to the ER. Maybe I can take care of it before they get there. Maybe I can prevent it. And so that was what I was set out to do. And so I was thrown right into it. The physician that was there when I got hired retired 2 weeks after, and it was just me. It was just me and my one attending physician who worked 3 days a week, and I inherited that whole practice practically.
Yep. And that's why we're going to have a whole podcast on that, Court, because people need to understand what direct primary care is and what we're doing. Absolutely. And it's like, I know we call it direct primary care, but like one of my biggest things that I want to provide to this community is health advocacy. Like you need a health advocate to follow you through this system.
You do.
It's not about you need to change primary care providers and you need to get rid of your insurance. That has nothing to do with it.
Not at all. Insurance is still a good thing to have. Yes. We want you to keep your insurance. That is not, that's one of the big questions about it. And we'll dive deeper into this in our direct primary care episode. But insurance is still a really good tool. I want to work with their doctors. Me too.
To help provide excellent care.
Mm-hmm. Me too. Excellent
care.
Well,
I'm super excited about this, Courtney.
I am too. I'm so
much to talk about. We're going to have a whole episode on big pharma. Yes, we're going to talk about it. Mm-hmm. We're definitely going to talk about it. Polypharmacy, big food, but and we're going to talk about
conversations versus being told what to do. That's important.
Yeah. And what we do and what we need to do as a society to improve it, because you can't fix the system, right? We've been in the healthcare system for forever. It's going to have its problems, but society needs to know how to navigate it better. And
Absolutely.
They need to know
and everybody
how to
has a role.
Health.
Everybody has a role, including the patients, including the communities, including our parenting styles, our bosses. Like everybody in healthcare that experiences healthcare or works in healthcare has a role, and I think we all need to change them.
Yes, absolutely. Well, I'm excited about what we're going to bring, and I'm excited about our next episode. And our next episode may be big pharma. Court, I think we need to talk about big pharma.
We're just going. We're just going to see what takes us, right? So if for anybody listening, if you're interested in anything, please let us know. Reach out to us. We've got email addresses. We've got our websites. We're going to publish this, so leave a comment below or whatever it is. So we want to know what you guys want to hear, because that's going to help us talk. And we like to talk. And Jasha, I'm super excited because now I get to talk to you even more.
I know. I know. I love it. I love it.
Yeah, me too.
Well, we are so stoked. We are ready to bring you some education. If you are ready to hear the truth, we are ready to tell you. We want you to get healthy, truly, legitimately healthy. And so we are so excited. We're going to be bringing this to you very soon.
Yeah. Well, thank you so much for meeting with me, and I'll talk to you later.
Court.
We'll see you next time.
Perfect.
Bye.
Bye.